Remember, this is an advanced Western country just like Australia, now frantically building temporary intensive care units in hospital grounds. And in all hospitals, including Cremona, new ICU beds are being rushed in to try and cope with the epidemic.
Sente questo rumore?
Come?
Il rumore.
Sì, cos'è?
È l'ossigeno.
40 anni che faccio il medico e non ho mai visto una cosa del genere.
Head of pulmonology at Cremona, Giancarlo Bossio, is getting by on a few hours sleep a night fighting this war. He says while the elderly have been dying in their hundreds, more and more young people are succumbing to the virus.
Purtroppo c'è una mortalità significativa. Non colpisce purtroppo, ahimè, solo le persone anziane. Abbiamo avuto anche un 23enne.
The toll on health workers here, now in their fourth week of this terrible battle against an invisible enemy, is crushing.
A casa ci vado qualche ora di sera, dove muoio sul divano e sprofondo in un sonno che non è sonno perché mi sveglio ogni ora con gli incubi. Mi aspettano mio marito e mia figlia che mi parlano e io non li ascolto. Loro mi chiedono se li sto ascoltando, ma io non li sento. Ed è terribile.
Professor, how do you see this ending?
Well, I'm sure that this will end. This will certainly end with the vaccination, and I'm sure that now no vax people will take the shot anyway. But it will end with many deaths, and I think that the world will never be the same, will not be the same after this. The world will change. Healthcare systems will change after this. Hospitals will change, because we're certainly going to have new pandemics. This is not the only one we will see in our life, and that will be the biggest lesson we will learn from this nightmare which is happening here.
More of our special coverage of the coronavirus crisis in a moment.
Choose from 50,000. Yeah.
I think that it's a country that you and I were in Las Vegas for our annual user summit at Atlassian, and now we're running our user conference this year online. We've already had over 12,000 people registered, so we're going to reach a lot more people with our online conference than we ever would have done in person.
What? The great fear
Happen tomorrow and the day after. I think that here in Lombardy we had something similar to what happened in Wuhan, and that it was just the explosion of a bomb. And then from there on, the disease spread very quickly, and if it happens like that, it's impossible to stop. It's an incredible number. They are like the tip of an iceberg.
It sounds like a living hell when you walk through your intensive care units. I mean, how are you feeling?
Well, it's an incredible stress for the healthcare system. And believe me, the healthcare system here in Lombardy is quite well organized. I mean, Lombardy is a very rich region, but still, despite all this, if the disease keeps spreading with this speed, we will get to a point where the number of beds in the ICU will not be enough for the number of patients requiring ICU admission. So, and we and you absolutely have to avoid to get to that point, because otherwise we will certainly get to a point where people will die at home because we will never be able to help them.
4 weeks ago, the state of Lombardy had 750 ICU beds, comparable with most Western countries. Now they have upwards of 3,000 coronavirus patients needing those beds. It's a medical war zone.
Tutti i sistemi di protezione individuali, dispositivi di protezione individuale, quindi il camice, i calzari, la cuffia, i guanti che sono da cambiare rispetto a quelli che addosso, la mascherina chirurgica, gli occhiali protettivi.
Carla Mastrini is the intensive care coordinator at Cremona Hospital. Coronavirus patients are placed on their fronts while being ventilated, so gravity helps the oxygen get into their bloodstream. It's medical protocol for patients with acute pneumonia, but it's not working and the staff don't know why.
Purtroppo qua da noi non abbiamo ancora visto nessuno risvegliarsi. Noi abbiamo bisogno di togliere il tubo a qualcuno e di vedere che qualcuno sta meglio, perché altrimenti non riusciamo ad andare avanti. Abbiamo bisogno di qualcosa che ci faccia capire che quello che stiamo facendo serve.
Australia is only weeks behind Italy on the pandemic timeline. But Professor Grasselli warns the difference between control and calamity can be days, if not hours.
Most of the countries in the world, in Australia, maybe still in the United States, Northern Europe,